Good morning, animal chiropractic friends. We are in the middle of a crisis. A massive amount of dogs will die between now and Christmas. They will die in the loving arms of their owners for these reasons. We've already had 3 phone calls this week. My dog was boarded over the holiday, the Thanksgiving holiday. He's 12 years old. He became unable to stand up in his back end. I took him to the emergency vet when I got home. They put him on every drug they had. Tramadol, gabapentin, Rimadyl, methylcarbamol. Drugs that actually act against each other, but also that cause some issues that are already going on in the dog. This dog has had a history of down in the back end in the past. He did it before. He got better. She got better. And life went on. And here we are. He's 12 years old in the dark part of the year. And he can't stand up. So I took him to the vet. They put him on these drugs. And we want to know if chiropractic can help. Or I should say it like they do. Chiropractics. That's not a word. Anyway, I'm here today to warn you that we are in the middle of a crisis. We're protecting more than just the dog. This video is about helping families. This video is about helping veterinarians who have to euthanize these animals. Here's what happens. We've had dogs come to us in this situation, and we recommend that the owner make the decision. Are the drugs working? And usually the answer is no. And if the drugs are not working, why are we giving them to the dog? There are 3 things that cause chiropractic subluxations or interference in the spine: trauma, toxins, and thoughts. And one of those big toxins is the medication. So what did this dog do over Thanksgiving? It went to a boarding facility where it was away from its family. That's an emotional trauma. What other issues are in this dog's life? Age is not a disease. However, we are in the dark part of the year, and dogs who have been on a dry kibble diet for their entire lives have built up an immense amount of inflammatory processes in their systems. We can't see the inflammation because it's inside the cells and causing those cells to not be able to communicate effectively across the dog. That said, oftentimes we change those dogs' diet to a non-inflammatory type of food so that they can heal. And we adjust them. And they get better. And they go on to live another year or 2. Granted, we can't keep them from dying. Every dog will die at some point in its life. That's the end point. But what we can do is help those families to make it through this holiday season without having to make that horrible decision and having to live with it. We can also help the veterinarian who feels they have no other choice, feels that they are at the end of their rope of choices to help this family overcome and get over their grief and their sadness about their dog. And so I've already had 3 conversations just like this it's Tuesday after Thanksgiving. I've had 3 conversations with animal owners. I bet I have 2 more today. And so the answer is this: find an animal chiropractor near you. Find one who is A.C.E.S trained. And why do I say A.C.E.S trained? Because our A.C.E.S graduates understand that adjusting less but more effectively helps that animal get through this inflammatory crisis. If there are many doctors out there, animal chiropractors, who have not been trained to effectively adjust the one segment that will solve this problem, and that is the atlas. It's the first segment of the spine behind the head. Why is that such a critical segment to adjust? Every nerve in the body goes through that segment, and if we adjust all of the segments that they find when they palpate your dog, even sometimes just palpating your dog can actually make your dog sicker. If they leave the dog on the medications because I'm afraid to take them off, they will be working against that toxin. And so as an animal owner, that's a decision for you to make. Just because your veterinarian prescribed it does not mean you have to give it to your dog. And if it's not solving your dog's problem quickly, it's not solving your dog's problem. Most people don't recognize that the side effects of those medications, one of the big side effects of gabapentin is ataxia, which is an inability to walk or an inability to coordinate the movement of the feet and the legs. And they're giving it to an animal who can't walk in the first place. So this is why this is a critical time of year. We are in a crisis. Many dogs will die before Christmas. Some of them younger, some of them older. And all of them have these common denominators. They're on a dry dog food. That's number one. Number two, they've had some emotional trauma, like they've been to the, doggy daycare or boarding facility. Number three, they come back and they start tripping and sliding and can't walk. Maybe they've had a physical trauma as well. Maybe they played too hard with their friends. And number four, it's dark out. So in this weather, there's no way for those animals to have enough minerals in their system. We know, because of a study done by Dr. Ava Frick in 2017, that 94% of all of dogs on any dry dog food are vitamin and mineral deficient. They are magnesium and calcium deficient, and we can't feed enough of that right now to make that change, especially if we're feeding a dry dog food, because dry food doesn't provide them those minerals, doesn't have the minerals that they need. It's not absorbable. You can't out-supplement them either. And so that's a big part of why these dogs become weaker and weaker and weaker. I want you to really consider that. Many of these animals get better with just a change of food, but the chiropractic adjustment removes the vertebral cause, the deep down cause that is creating the hind end weakness. And understanding the neuroanatomy is essential. So our graduates at A.C.E.S all understand that neuroanatomy really, really well. And some of them may still subscribe to the adjust everything you find. And if that happens, your dog will get worse. If they don't adjust only the atlas and ask you to come back in 3 days, the dog will not get better as fast. And you'll feel like that's all you're going to do. That's all the dog needs. If we do too much, they'll get worse. Find us today at All Creatures Every Spine if your dog is in need of a big change so that it doesn't die before Christmas. Find us at animalchiropracticeducation.com. In the resources, if you want to understand this at a deeper level, if you are a veterinarian or a chiropractor who would like more information.